I'm Kara Richardson. I'm one of the PAs here that does injections, and this is Miss Beth. She's sweet enough to be our demo today. We are going to do a few things. We have already done some of her Botox in her forehead and in between her eyes. We're going to do a little bit more around her eyes, but I want to wait till after we do her filler in her cheeks, okay? So what we're going to work on Beth is we're going to give her a little more defined cheek. At rest, it's not obvious that she needs it, but smile big for me. You start to see these breaking lines where the volume in our cheekbones is lost. And so if we build that back, we get a better light reflection and support for when we smile to not create those little lines. The other place we're going to work on is a little bit on her jawline. She is young and beautiful, but she's starting to see just a little bit of that heaviness in the lower face. And to give her the most natural look is to build back on her jawline itself, okay? The last thing is she would like her lips to be a little fuller, so we're going to also do her lips and a little on each side of kind of her chin to create less shadowing also there, okay? So we're going to start in her cheeks, and then we're going to work our way down to her lower face. If y'all have questions, please feel free, yell at me, and we'll answer, okay? All right, we're going to get started. So when we're doing filler, there is lidocaine in the product, so she has been numbing for about 30 to 45 minutes with topical numbing, but the product itself will also help it be more comfortable as we go along, okay? I'm going to clean her off one more time. We did a lot of this prep in the back, but... Okay, so we're going to start right here in her cheek. All right, Miss Beth, you ready? Pinchy. And we do a lot of our injections with little insulin syringes, so they're even more comfortable. How you doing? Good. Great. Great. That looks beautiful. So anybody who wants to come up and look, you can see, but you can really see how it starts to pull up even the corner of her mouth and gives the eye that upward. So instead of focusing on this downward pull. So we're going to do just a touch more here, and then we'll be done on this side. Or actually, I'm going to do her jawline next. I'm sorry. I'm going to finish this side on cheeks and jaw. That's beautiful. You doing okay? Good job. Okay. So on this one, we really want to project at the angle of the jaw because that's what's supporting what's going on in this jowl area and along the chin. So we want to keep this jawline sharp. She has a beautiful long neck. And so we want to make sure that we don't have any wave to the jawline. So I'm going to tilt your head just a little bit. Pinchy. You doing okay?
Thank you.
One more. Deep breath for me. And that's perfect. And then let's do the other side and then we'll do a roll. Okay, I'm going to come around and work on the other side. That looks good. And especially when you smile. So you can see she's still breaking over here, but not over here. No, I did both. Thank you. Okay, so I'm going to tilt you, drop your chin just a little bit and tilt just, there you go. We're going to do a little bit right here. Deep breath. Do y'all have any questions? Voluma. So all the fillers almost all the fillers, there are a few, are hyaluronic acid. So they are something that our body naturally has to help support the cells. So it's what hydrates our cells to give that support. So hyaluronic acid is also a very safe filler because if there were any issues with it or any problems, it can be broken down immediately with a product called Vitros. So, all right, one more on this one. And I'll tell you, when we get to the lower face, we're going to switch fillers as far as which ones, and I'll tell you that too. Let me just look. That's perfect. Okay, now we're going to work again right here on your jaw. And Jordan, let's do her Botox to her crow's feet just so I can talk about the difference in the filler and the Botox. That's good. Okay, one more. Thank you. Okay, and I'm okay with no ice. So this is Botox, and what I wanted to talk about is what we just put in was all for volumizing. When we talk about Botox, what we're trying to do is minimize movement. So we're trying to decrease the movement in the area so that you're not wrinkling as strong and you're allowing the collagen to play catch up. So as we age, we don't make enough collagen to keep up with our facial expressions, so we start to see wrinkles at rest. And if we relax that movement, the collagen can fill back in and actually smooth out those lines that may already be there. The difference, people ask all the time, when should you start Botox? There's no perfect answer to that. You can be very preventative by starting in your late 20s, early 30s, because you may have very minimal lines at rest. But someone who waits longer is still going to benefit because it just may take them 2 or 3 treatments before they're really seeing the result. Okay? Yeah? This is not. So this was the filler. And this is going to be filler down here. So that's a good question. Botox typically is used more for the upper face. We do have some areas in the lower face that we use it for, but your volumizing is usually what's needed in the lower face because we don't want to stop your smiling. We don't want to create anything abnormal around the mouth. Okay? Okay, smile big for me. And relax. Smile big and relax. And a couple of other things on Botox, it takes 5 to 7 days to see the results. So with your fillers, you're getting to see them right then. That's the beauty of it. But your Botox, you do have to be patient. Give it 5 to 7 days to really start to create that block with the muscle and nerve reaction, okay? All right, I'm gonna come around. Smile big, relax. Good job. Okay, now we're going to switch to Juvederm. So there are just different fillers that are better for different areas. It has more to do with the consistency of the filler. So I always say there's heftier fillers that are good for support. We're trying to build up that cheekbone or that jawline. And then there's softer fillers that are better for areas that are going to move with expression. So that way they look very natural while they're in your face. What we want for here is really just to create less shadow. So we have a fat pad that as we age thins out. And when our fat pads thin out, it creates a depression, which creates a shadow. So if we bring back volume, we bring back light reflection, okay? So that's what we're aiming for here. And then we talked about, she just wants her lips a little bigger. I mean, we're not going to make them look crazy, but we want to give them that fullness that she once had. So she's always had naturally plump lips, and she's, with age, we lose a little bit of that too. So, our goal is never to make anyone look unnatural. Our goal is to make you look refreshed or brightened. Okay? Thank you. Okay, so we're going to start right here. You ready, Miss Beth? Deep breath for me. Good job. Yeah, we can start to see that filling in. We're going to do a little bit in the corner of her mouth too. Okay, thanks. Let me look at you for just a second. Oh, that's perfect. Okay, we're going to move around this way. And we all have a side that is worse than the other. Yours is your right side. So for whatever reason, it can be we favor it in sleep, or some of it can just be the way we're made. But there is usually one side that will need more volume than the other. And I think one of the things is, as we age, we start to notice those asymmetries because of the volume loss that happens in our face. So it may be something we've never noticed until we start to lose this cheekbone in one eye, or you start to notice more heaviness on one side. So that's not uncommon. Juvederm Ultra Plus, which I like for especially in what we call the marionette lines. It is a little bit thicker than the Juvederm Ultra. Okay, and then I'm also going to soften this little line in her chin. Those are pretty common too, to start to see this little crease that we get there. This can be combined with Botox if needed. Some people will get what we call a golf ball chin because it gets dimpling as that muscle is contracting tighter and tighter. She doesn't have that. She just has the little line where she's lost the volume there below the lip. So I'm just going to fill it in. I don't know if y'all can appreciate that, but that's, her line is basically, it's like a magic eraser. Makes it all go away. Okay, let's do a little bit in your corners and then we're going to do your lips, okay? You holding up okay? Yeah. back to asymmetry. Her lips are slightly asymmetrical. She has a little bit more raise on the right than on the left. So we're going to start by correcting the lower side and then make the higher side match, okay? So we're going to start right here. That is beautiful. Okay, look at me. And we're going to put one more little point to this one. Are you feeling okay? Mm-hmm. Okay. So we're going to give another eye spray. So what I wanted to correct there, one of her lips was actually even more rounded, so I tried to bring more of a peak to it to make them match even more. Okay, doing good. That's beautiful. Okay, we're going to do just a little more. Can you hold one on top of her head? Okay, a little ice back right here. Just to give her some distraction. Thank you. Okay, now we're going to just volumize. That is beautiful. Mm-hmm. You're going to love them. Okay. I prefer to do half of the top lip and go ahead and finish the bottom match on that side and then go to the other side. So just a preference. Topical numbing. Yes. Lips are always the stingiest. They just are sensitive. We're going to do a little tap, okay? And as far as downtime, your lips are going to be kind of ducky for the first 48 to 72 hours. That's just, they swell more than anything else, so that's just part of it. But ice every hour helps, and then we also give you arnica, which is a vitamin that helps with bruising and swelling, that we have you take for 5 days. So we try to minimize it as much as possible, but they're, how old are you? 31.
You're getting lots of smiles.
Yes. That's beautiful.
It is very pretty.
Okay, we're going to work on the top again. Deep breath.
Great job, girl. Keep breathing. Thank you, Jordan. Deep breath. Great job.
You mind, thank you.
How many vials are you using?
So, not very many at all. We are going to end up using 2 to do each, or to do all these areas. So we did 1 vial of Illuma, which I spread between her cheek and her jawline, and then 1 vial of Rejuvenation Ultra Plus for her lips and in her marionette lines. So, it all depends on the face, how much we need. I really like to do things in stages too, because you're going to get a more natural look if we do that. So we don't have to come in one day and do it all. We can do a little bit, come back a few weeks later, do some more, and it helps us address everything individually too. Okay? Sorry. Thank you. Okay, one more little spot. Okay, deep breath. One more spot and you're done, my dear. That's perfect.
I got this.
Thank you. And she's all done.
Could you explain again the Voluma up here is thicker and
So it's more supportive is the way that I would say it, because it's the gel itself it actually does hold its form better, which allows it to be better for bone structure. So again, we lose some of that bone or thinning of the bone, so we want something that will stay in place and actually break down very slowly too. So Voluma is the longest lasting at 2 years. So I tell people, you may not get a full 2 years because at 18 months you're going to notice that you're starting to see it break down. And we usually don't want to go all the way back to baseline. We would like to keep it up. So at 18 months we're usually doing a touch-up treatment, but it's not uncommon that we don't need as much at the touch-up treatment as we did at the initial treatment.
and then
The Juvederm,
you use one unit down here and one unit of Voluma up here.
And her I did. I would say on average, most people use 2 Voluma. Usually we need 1 for both sides. And then 1 to 2 for around the mouth. Depending on if we're addressing this, and the lips, we may need 2.
So would you use different products for the lines and then a different one for the lips?
So in the
What
lips,
rest of one? Because I think I had that one coming. I couldn't see part of it.
so they're all hyaluronic acid fillers. It's just the name brand. They do all have kind of their little niche in what they're good for. So there are Restylane products that are a little thinner that we sometimes prefer in those fine lines versus the Juvederm products that are better for sometimes that lip volumizing. She's younger and she needs true plump. She doesn't need the edge really defined. She still had a crisp border. But someone who needs more edgy, we might use a Restylane product because it will do a better job of that. So it really is up to your injector. I mean, that's why we always do consults for free, because we want you to come in, understand why we're using what we're using in your face. Okay?
So this is what we would do instead of
Today, consults are